Hey, it's Jim Mike Heinzman here in East Athens Physical Therapy. We're in the new Oconee office. We're in our recovery room. I'm going to do a quick video to show you guys our HRV machine. We use it all the time. It's heart rate variability. I'm just going to run through this real quick and kind of show you what we do. On a second visit, we'll bring a patient in here and check their HRV. It's basically a snapshot of their nervous system. Most of the folks that come in here are either in pain or they've had surgery, and usually their nervous system is out of whack. So this allows us to get a baseline, and then we can do some certain stuff in the clinic to kind of make it get balanced back out. And it just helps with everything as far as sleep, anxiety, brain fog, recovery, because we want rest and recovery, and the nervous system is a big part of that. So I'm going to show you through here. We just put a name and a date in here. This is John Doe. We'll just toggle through male or female, and then we'll put a birthday in. So, and what we do is it's like a fancy EKG. So there's pads that go on each wrist, and it gives us a reading. So John Doe here, he has his tension index is a little high. It's 199, and normal is between 10 and 100. So got a little bit of stress in his life, but that's nothing. 199 is actually not too bad. Usually most folks in here could be a little bit higher than that. I go over here to this one. This one is about total power. So you have a sympathetic and a parasympathetic part of your nervous system. Sympathetic is fight or flight, and then parasympathetic is your rest and recovery. So we want this number to be pretty high because we want more rest and recovery. So we would want to see this number go up if we test him again. And we would test at second visit, and we would test every 10 visits after that so that John Doe would know if he's improving or not. And usually it correlates to them feeling better. This right here is the brain fog one right here. He's pretty good at that. He's at 53. He's within normal limits. So, brain fog is just kind of not being able to remember anything, feeling like you're in a fog. And it can be easily turned around if we do certain things to kind of get the nervous system to function a little bit better. All right, I'm going to show you this one. This one everybody loves. So this is the snapshot of your nervous system at the time of survey. He was 49 years old, and John Doe he's testing now as a 48-year-old. So this isn't a really bad test. It's actually decent. He just got a couple things to work on. This right here, this complex state index, it gives us a reading. And we have a little report card down here. And anything below 40, we would do some treatments to kind of help the HRV and try to get things balanced out. But he's above 46, so we probably would just do normal physical therapy, use the newbie in a normal way, and hopefully in 10 visits, this number would be any higher. This is one last graph I want to show you. It's kind of cool. This kind of tells you when your body is performing at its peak performance. So for John Doe, any major decisions in his life where he wanted his body to be at top function so he could make a great decision would probably be at noon. And then maybe again right around 5 o'clock. And then after that, he probably shouldn't make any more decisions until the next day. But that's a cool little screen that patients really like to see and kind of see what times of the day that they function the best. So this HRV, this is kind of, we put some nice music on with TV and just let folks recover in here sometimes. And just a really nice room, great technology. If you want to come in here and try to check out your HRV, if you're a patient, you get it every time. You'll get it on a second visit and every 10th visit. And it's just a really cool piece of technology that we use in the clinic.